Okay, this is today's news release of April 9th, 2020 at 7 p.m. Actually, it's at 4 p.m. And this is news release number 17, coronavirus COVID-19. So at this time, the city of Cordova COVID-19 confirmed positive case count is 0. Testing in Cordova. As of April 10th, 2020, there have been 12 COVID-19 tests conducted in Cordova with 0 positive results. There are currently 2 tests awaiting results. Local healthcare providers have the capability to test approximately 300 people in Cordova at this time. Antibody tests were considered for purchase by City Council and referred to City Manager for further research, which yielded evidence that the tests may have been counterfeit and purchase was not advised. The Abbott ID Now machine has arrived at Alaka Community Health Center, and rapid testing for COVID-19 will be available starting Monday, April 13th, 2020. Cordova Community Health Center and Alaka Community Health Center will also continue to provide testing through Alaska State Lab and Quest Lab. Your local healthcare provider will order testing. The type of testing you receive will be based upon the severity of your illness in accordance with the State of Alaska Department of Health and CDC guidelines. Please call your healthcare provider if you have any nausea, diarrhea, and/or cold-like symptoms that have not resolved in 3 days. Additional testing supplies have been requested. Just a clarification on outdoor recreation during quarantine. The City of Cordova's Incident Management Team was recently alerted by the State Emergency Operations Center Public Information Officer to a clarification to State Mandate 10. Per that mandate, which supersedes all municipal mandates, individual 14-day quarantines, including those who have recently traveled, are not allowed to leave their homes for purely outdoor recreational purposes, such as hiking, biking, and hunting, even if the minimum social distance is maintained. This means that if you're currently in a 14-day travel-related quarantine, you're not allowed to leave your home to engage in recreation. You may be outdoors on your own property, but not beyond. You may only leave your designated quarantine location to receive critical medical care. The same exemptions that were already in place for critical infrastructure workers remain. They may travel to and from work and to obtain supplies and materials necessary for their critical infrastructure position, but otherwise must remain under quarantine at their designated quarantine location. This is not a new mandate, but rather a clarification to the existing mandate. All signage and materials are currently being updated by the city's Public Information Officer team. Another clarification on small community travel exemption. During yesterday's state press briefing, Commissioner Crum provided a more comprehensive definition of hub hospital to also include critical access hospitals, sole community hospitals, and acute care hospitals. According to Commissioner Crum, communities with one of those 3 types of hospitals are the communities that we want to make sure there is still travel going in and out of. Chief Medical Advisor Ann Zink also commented that from a health perspective, do not believe there is a test-based strategy better than a 14-day quarantine if you're moving from one community to another, and that would apply to a community like Cordova. That's our best strategy to protect communities. Governor Dunleavy also addressed that question, saying that a detailed answer to this question would be provided in the state's press briefing today. Just a little on the use of cloth face coverings in public places, which are highly recommended. On Friday, April 2nd, 2020, the state of Alaska announced a strong recommendation regarding the use of cloth face coverings. Scientific evidence available to date indicates that asymptomatic and pre-symptomatic shedding of the virus that causes COVID-19 is occurring. This heightens the need for community-wide implementation of control measures to prevent the spread of COVID-19 among people who are not experiencing symptoms of illness. The primary ways to do this are through social distancing, frequent hand washing, and disinfecting high-touch surfaces. Another tool that may help to minimize transmission while people are around others outside of their household is the use of face coverings. Because we are experiencing a nationwide shortage of medical supplies, including face masks, we recommend that Alaskans make their own face coverings and wear them in public settings where other social distancing measures are difficult to maintain, essentially grocery stores, pharmacies, and others, especially in areas of significant community-based transmission. This follows closely recent guidance from the Center for Disease Control, which can be found at www.cdc.gov. There's a longer link there that will be available on the Cordova City's homepage, cityofcordova.net. Just follow the banner and you can reach this and all the previous press announcements and press briefings. The following measures are also highly recommended for all Alaskans. Wear a face cloth covering in public settings where other social distancing measures are difficult to maintain, e.g. grocery stores and pharmacies. Make sure the face covering covers both the nose and mouth. Do not remove the face covering until you return home. When removing the face covering, avoid touching the front of the face covering because it may be contaminated. Remove it by grasping the ear loops, ties, or bands and immediately discard or place in a designated container for laundering. Wash your hands immediately after removing the face covering and before touching anything else. Wash face coverings in a hot, soapy water between uses. Do not wear N95 or surgical masks. These are needed by healthcare workers and first responders. Do not rely on face coverings as a primary way to prevent COVID-19 transmission, and be careful to avoid developing a false sense of security through the use of face coverings. Continue to follow social distancing measures, including maintaining at least 6 feet between yourself and others, staying at home, avoiding touching your face, and washing your hands frequently. For more information and to view the entire State of Alaska Health Alert 10, please visit dhss.alaska.gov. And the full link is on our informational website. For cloth face coverings in Cordova, many individual volunteers have already begun producing homemade cloth masks in Cordova that fit the guidelines above. If you are in need of a cloth face covering, an online sign-up form has been created to request a free cloth mask for your household members or employees at bit.ly/CDV mask sign up. On the form, you will be asked to indicate if your order includes anyone who's a worker of an essential business as listed in Alaska Mandate 10 or anyone who is considered high risk. This fully volunteer effort is accepting donations of heavy-duty cotton or flannel fabric that at least a half yard in size. Please contact Emily Love at area code 503-974-8197 if you're interested in donating to support this effort. That number again, 503-974-8197. The Incident Management Team growth. As this incident devolves and planning progresses, the Cordova COVID-19 Incident Management Team and City of Cordova are exploring avenues and forming teams to expand their efforts. Mike Hicks has decided to stay on as police chief for the City of Cordova beyond May 1st, likely through the summer, to assure stability and support on public safety and law enforcement in Cordova. In addition to his continued role as police chief, he also joins the incident management team as deputy incident commander. One of his first duties in this role has been reaching out to the State Public Safety Commissioner to review plans and guidelines for working on COVID-19 related enforcement in our community. Dr. Hannah Sanders is expanding her incident management team medical advisory team, is appointed Dr. Blackadar as a boots-on-the-ground deputy medical advisor in Cordova. Several task forces are being formed under the operations section of the incident management team to focus efforts on securing ports of entry, sheltering, coordinating with first responders and public safety, and enhancing communication to all populations in Cordova. The incident management team's commercial fishing task force has begun meeting and is working to ensure clear ideas about how to manage Cordova's harbor and fleet as they arrive. Industry group meetings composed of local processors, CDFU, Copper River, Prince William Sound Marketing Association, and Alaska Department of Fish and Game have been facilitated regularly with the incident management team for several weeks, as well as regular meetings between the incident management team and essential businesses. These meetings create open two-way communications between these entities and the incident management team. They also offer access to medical oversight for these groups as they make plans to serve the community and fleet in the safest way possible and ensure that mandates and guidance from city and state regarding COVID-19 are clearly communicated and understood. Meetings have also begun to facilitate cooperation between the city incident management team and privately organized local groups. Tents are needed. The City of Cordova Incident Management Team's Shelter Task Force formally requests donation of or loan of camping tents from the community. The Shelter Task Force will be using tents for isolating individuals without the means of self-quarantine in the quarantine shelter and alternative care facility. Tents can be dropped off in front of the Cordova High School Monday through Friday, 8 to 4, along with an attached tag containing individual contact information if the tent is to be returned to the owner. Tents will be used only as needed so as to avoid contamination. Tests without a tag will be deemed disposable. We thank you. Small vessel and tender vessel plans. Members of the Incident Management Team's Commercial Fishing Task Force, along with fishermen and fisheries groups from around the state, have been collaborating with Discovery Health MD to create sample onboard procedures for catcher boats and tenders that will prevent the transmission of coronavirus when the salmon season gets underway in the coming months. Today, Discovery Health MD released a reference guide, including a draft procedures manual, a draft checklist for captains, a number of handouts for crew education, and a notice from the state of Alaska on the use of cloth masks during air travel. More information in the full document can be viewed at amsea.org. More sample plans, including large vessel information, is available at https://ready.alaska.gov/COVID-19-worker mitigation plan. Ordinance 1185 was passed by City Council, putting forth enforcement measures to support Cordova Health Mandate 1 and Emergency Order 2020-2, along with any future orders associated with this emergency. According to this ordinance, failure to comply with an emergency mandate adopted under the City of Cordova's state of emergency is punishable by a fine of up to $500. Upon citation under this section, court appearance is mandatory. It's expected that this ordinance will be brought forward again for public input and council discussion with proper notice to the public. That will happen on Monday at the noon meeting. That meeting will be scheduled and publicly noticed today with the agenda posted on the City of Cordova's website under the government tag. The Native Village of EAC City Council Joint Work Session. Yesterday, the Native Village of EAC and EAC Tribal Council members joined City Council for a joint work session to discuss integrating Native Village of EAC leadership and staff into the current COVID-19 incident command structure. City Council, Incident Management Leadership, and the Tribal Council were all in strong concurrence that working together in every possible way will be a benefit to the community. More discussion will continue between the two groups as they agreed to regular weekly joint work sessions. So just a reminder on some closures and information venues. There's been a new playground closure this week. Effective immediately, the City of Cordova Parks and Recreation Department has closed all city-owned public playgrounds, including the Mount Eccles Elementary School playground. These are considered high-touch zones, are open 24 hours a day, 7 days a week, and resources are not available to keep all surfaces disinfected and ensure public safety. There's an Odiak Camper Park closure. The incident management team also closed the Odiak Camper Park for the season per its medical advisory team. So to keep Cordova informed, there's a new user-friendly Cordova COVID-19 website. The City of Cordova has enlisted the help of a web designer to create a new webpage for Cordova COVID-19 information with the goal of providing more information that is easier for the public to find to access. We hope to launch this new site very soon. Translations. The Cordova IMT Public Information Team has begun efforts to translate all official posted signage and daily releases to both Spanish and Tagalog. The Public Information Officer team also plans to work with processors to ensure that translations of key information is available in all needed languages to keep their staffs informed of COVID-19 mandates, guidelines, and developments. Radio updates and frequently asked questions. Members of City Council of Cordova COVID-19 Incident Management Team are hosting regular COVID-19 radio updates on KCDV FM 100.9 and KLAM AM 1450. The programs include frequently asked questions and answers, as well as pertinent local, state, and federal updates on COVID-19 status and planning. Tune in on the radio or listen to archived radio updates, and those can be found at youtube.com/Cordova TV. That again is youtube.com/Cordova TV. Weekly news briefings. The City of Cordova's COVID-19 Incident Management Team will continue to host press briefings each day at Friday at 4 p.m. This is one of those. These are streamed live and available in the archive afterward at youtube.com/C/City of Cordova, Alaska. Infographics. The City of Cordova's COVID-19 Public Information Team has developed a series of topical infographics, which are graphic visual representations of information, data, and knowledge intended to present information quickly and clearly. These will be released to the public and targeted user groups as they're produced, and we invite the community to share them. I'll just go ahead and remind the community, that these facilities are closed. New this week, all public playgrounds in Cordova are closed, effective immediately. Also closed are Cordova School District, Cordova Public Library, Cordova Historical Museum and Gallery, Bedarkey Recreation Center, Bob Corn Memorial Pool, and the DMV is available by appointment only between the normal hours of Tuesday through Thursday, 8 a.m. till 3:30 p.m. until further notice. Only one person will be permitted into the DMV office at a time. Please call 424-6125 to schedule your appointment. City Hall is also available by appointment only through their normal hours of Monday through Friday, 8 a.m. to 5 p.m. That started Thursday, March 19th, 2020, and will remain in effect until further notice. Utility payments may be dropped off in the drop box located near the exit of the upper parking lot. You may also contact the Finance Department regarding other matters at finance and then the number 2, so that's finance2@cityofcordova.net and finance3@cityofcordova.net. Please call 424-6200 to schedule that appointment. The Harbor. Beginning Friday, March 20th, the Harbor office will be closed to walk-ins. Payments can be made by mail or by phone Monday to Friday, 8 a.m. to 5 p.m. Appointments can be made to purchase shower tokens in bulk Monday through Friday, 8 a.m. to 5 p.m. Shipyard services are also by appointments. Starting March 20th, 2020, the Harbor Department will not be accepting mail or packages. If you have mail or packages being delivered to the Harbor office, please make other arrangements. And now some useful websites regarding coronavirus. The Center for Disease Control and Prevention at coronavirus.gov. The State of Alaska Department of Health and Social Services at coronavirus.alaska.gov. Or you can dial 211. This is the State of Alaska's information line for non-clinical questions, and that's at dialing 211. And the City of Cordova is at cityofcordova.net. The Incident Management Team, which collaborates with our medical professionals and emergency management teams around the state, feels that the curve has been flatter in Alaska and virus incidence has been fairly low because of the social distancing and other steps that the tribes, governments, businesses, organizations, and individuals have put in place to protect themselves and their communities. We cannot emphasize enough how critical it is to continue these practices. Let's do our part and practice the CDC guidance to help keep Cordova free of COVID-19 for as long as possible. Please take every precaution to care for yourself and loved ones. Updates will be posted regularly at Cordova Prepared page of the City of Cordova website and at facebook.com/groups/Cordova Prepared/. Your general information, questions, and suggestions can be directed to cordovaprepared@yahoo.com. Thank you, and have a safe, good day, Cordova. Bye.